Hi, my name is Johanna. I'm a coach and hypnotherapist, and I specialize in perinatal mental health. So, today I want to talk about why we get stuck in overwhelming emotions after a traumatic event. And since you're watching this video, that traumatic event is most likely linked to your pregnancy or your birth, maybe a traumatic birth experience. And whether it was you or your baby, or if you're watching this as the partner of the mother giving birth, or even as an adoptive parent or a grandparent, a loved one who was left traumatized by the event, anything goes. The thing is, you've become stuck in that traumatic event and you're experiencing symptoms that are messing with your quality of life. So whether you are consciously, continuously reliving the moment, or maybe have become extremely anxious around your newborn, maybe you feel dissociated from them, like you can't bond with them or feel the way that you were expecting to feel when they finally arrived. Maybe you're trying to cope with loss. Maybe you're trying to cope with anger, having severe intrusive thoughts regarding the traumatic event. At the end of the day, the fact of the matter is you're looking to get rid of this negativity that is controlling your life. You want to get back to a balanced and happy future with your loved ones. That's logical. And there's good news because this is truly possible. What's very important is for you to start to have an understanding of not so much where these feelings are coming from, because that's probably obvious, but why are you stuck in certain feelings and certain behaviors? Why can you not move past them? And I'm going to try to explain to you how that works in the hopes of you starting to understand why you, with your individual and unique situation, are in this place, why you're stuck here. And I'm going to try and explain it to you in an easy way, hopefully. And I'm going to start with your brain. So your mind, since that's where your thoughts are made and where your feelings are stored. Now, each and every one of us obviously has a mind. And that mind is divided into two parts. It's divided into the conscious part and into an unconscious part. Now, two things are important to know here. First of all, that unconscious mind, it's limitless. It's huge. Every single thing that we have ever experienced in our life so far, it's stored up here. Thing is, we just don't need all these things all the time. So most of these thoughts and feelings and experiences that we have had in our life, they are stored away. It's like a big walk-in closet that has lots and lots of space at the back for stuff that we don't use on a daily basis. And the conscious mind, compared to the unconscious mind, it's only a very, very small percentage. It's like 90%, 10%. It's the stuff at the forefront of the closet, so to speak, that we use on a daily basis. So the conscious mind is the stuff that we use on a daily basis, that we say out loud. That's the logical part of us. And the second important thing to know here about the mind is that it's there to protect you. It's there to protect you from harm, from potential harm. So how does it do that? It does lots of stuff automatically to keep us safe, where we don't even have to think about it. And an example of this is breathing, or our heart beating, our blood flowing, our food being digested by our organs. We don't think about these things consciously all day long. Can you imagine yourself thinking about each and every blink of your eye and each and every breath that you take, each and every heartbeat? If we would be doing that at a conscious level all day, we wouldn't function properly. That would take up all of our time. So it's a bit like that big walk-in closet, right at the back. That's where all the stuff is stored that we can automatically do. It keeps us safe. It's there. It's good to know that, but we don't really use it. We don't stand at the back of it looking through each and every piece of clothing, or every sock that we've ever owned, every shoe or pair of jeans. We leave them there because we don't need them at the forefront of our closet at the forefront of our mind all the time. We need to focus on the stuff that's on the forefront. So every thought and every feeling that we have stored in that closet, that back of our mind, every thought and feeling that we have is connected to something. It's connected to what I call an unconscious payoff. And what I mean by that is when, for example, when you were small and you would cry as a baby, you knew that would trigger someone to come to you and to help you. For example, your mum. That's the way you would get attention from your mum. So that's the way that we learn to deal with emotions. We attach them to an unconscious payoff so we know that we get stuff done. For example, when you raised your finger in class, you knew that you were allowed to ask a question and you would get the payoff of an answer. Another example is when doing sports. You knew that if you pushed through a training and gave it your all, that you would get the payoff of becoming better despite the sore muscles that you would have. You didn't think about these things consciously. It just became your way of doing. It's the way that we learn. It's the way that we see results. It's the way that we feel results. You didn't think about them too much at the time because they were unconscious processes, and you probably don't think about them too much now because you've stored them all away at the back. You don't need them continuously. They're all stored in that unconscious closet. But doing certain things in a certain way, it gives you that unconscious payoff. And those are really basics, or how we do things in life. So if you want to get better at sports, the unconscious mind puts all these internal systems that are working in the back to keep us safe, puts it into action. It puts it into action to make your legs run faster or kick a ball harder. These automatic function, these unconscious things at the back working to keep us safe from harm, they ensure that you sweat during sporting so you don't become overheating. It gives you sore muscles. It gives you that pain warning so you don't go too far. And it grows your muscles for you at an unconscious level. You don't think about that consciously, but you know that the action, that unconscious payoff, is going to ensure that these muscles will grow and get better. So that's that payoff. And all the while, its most important task is to keep you safe. That unconscious mind to keep you safe and to implement all these systems in the back that you don't need to think about. That will get you bigger, better feelings, bigger, better results, and in the meantime, keeps you safe because that's its primary job. And it does it all naturally, organically, without you consciously, with that 10% of your conscious mind having to think about these processes. So how does that now link into you not being able to let go and move on from a traumatizing event in your life, or an event that is causing you to have lots of negative feelings and emotions? Now, some things in life that happen to you, your unconscious mind has responded to them in a way that benefited you. It served you. You went through an event in your life, and your subconscious mind then created a way for you to cope with that event in such a way that keeps you safe and that works in that moment for that specific problem that you may have had in that specific time frame. Now, I'm going to try and clarify that by giving you an example. And the first thing that comes to mind is a client with severe anxiety that I had a couple of weeks ago. And she had severe anxiety and also huge issues with parental rage. And well, probably as you can imagine, that was really ruining her life. It was really, really taking all the joy, zapping all the joy from parenthood for her. And during that session that we had, we discovered that her mind was giving her an unconscious payoff by staying in that anxious and angry place. And what we discovered was that her unconscious mind had linked certain events around her traumatizing birth experience to an event that had happened previously in our life, like years before. And what had happened, basically, I won't give you all the nitty-gritty details, obviously, but what had happened years previously to giving birth, she was at a party with a friend and she'd become locked into a room. I think it was the toilet, I'm not entirely sure, but she had rung her friend on the mobile phone to ask her, can you come and help me get out? But her friend was drunk, intoxicated. It was a very noisy environment. I'm not exactly sure about the details, but her friend couldn't understand what she was trying to say to her on the phone. So after repeatedly trying to phone her to ask her for help, this lady had gone into huge panic attack mode, being stuck in a small space. So in the end, that panic started to go into fear and rage. Rage mostly, as she explained to me at the time, at her friend for, rage, frustration turned into rage because her friend wasn't picking up the phone. So she decided to eventually use aggression, utilize that rage and that fear to kick in the door. And she was out. She was safe. She was lightly injured, but she was safe. So the unconscious payoff here was that her unconscious mind had used fear and rage to get her to a safer place. So it served her in that time, at that moment, to cope with that problem in the context and the time frame of that event happening in the club. So years on from this event, when she was faced with a completely different situation, giving birth to her baby, similar feelings were stirred up again. And during her birth, she wasn't able to move when she wanted to move due to the medication that they'd given her. And she felt extremely fearful about giving birth in the first place. And the pain control then wasn't doing its job properly. And lots of other things going on around the birth that were very uncomfortable, that spiraled into becoming fearful and even anger at the way she was spoken to by one of the doctors. Now, what probably happened is that her subconscious mind, it went into sort of that metaphorical walk-in closet to look for a life event that was similar to the event that she was now going through, giving birth, where fear and anger and pain were all tied up together. And basically, when the mind went into that metaphorical closet, it found that similar situation, and it tied these same feelings and the same reaction into the situation that she was in. So what's important to know here is, it doesn't sound logical to tie these feelings and that experience into this experience, but it helped her through that traumatic birthing event at the time. It gave her the adrenaline to go through it again. And what the unconscious mind is lazy in that way, that when it finds something and it links it to an event and then sees that unconscious payoff of it working for the event, the rage and the adrenaline that this lady got to go through the birthing experience despite what she was going through, the unconscious mind now has a payoff. It works. I've been able to keep my person safe, and she safely delivered the baby. And yes, there were lots of negative emotion involved, but hey, it worked. It kept her safe. And that's basically the job of the subconscious mind. It ties in a memory. It works. Person is safe. Now I'm going to sit back and relax. The subconscious mind can be a bit lazy that way. So it sprinkled in all those familiar emotions, made the body safe, survived the birth, and hey presto, we'll deal with the rest later. But then later, after weeks after the traumatizing event for the mother, she's now stuck with anxiety and anger. And each and every time that she's reminded of whatever went on, that anxiety and anger pops up again. That's the unconscious payoff. I've linked an event to a certain emotion, and every time it comes up. And, fairly often you know, when you're with a baby and you're talking about the event, you're talking about the birth, it keeps coming up and it keeps being regurgitated. And that way it's now starting to grow. I hope that makes sense. You know, our unconscious mind ties in memories and feelings from the past, and they then become sort of the most natural ones to display, because the subconscious mind is now leaning back in the closet thinking, oh, I've brought that to the forefront. It worked, and let's leave it there. Let's leave the other 90% at the back there, and let's leave this here. It's not the best or the most logical one to choose from, but logic is not the thing that the subconscious mind does. That's what the conscious mind does. So consciously, we know our reaction isn't the best. It's not the most logical one to become angry at our baby. It's not the choice that we want to make, but we do keep making it because it's steered on by the subconscious mind, and the subconscious mind is a lot stronger. You know, that's the resource it's come up with from the back of the closet, and that's now at the forefront of the closet, and that's what we consciously start to display. And that's where, you know, when we're talking about wanting to let go of these negative emotions, that's where advanced conversational hypnotherapy can assist. That's a therapy that I use. Basically, what it does, it's retrieving all the other stuff from the back of our closet, because we know that there's many, many more choices stored at the back there, but we just don't seem to be able to bring them to the forefront because our subconscious mind has decided, I've brought this to the forefront, it worked, it kept you safe, I'm now going to lean back and relax again. Because that's basically what it does. So we're now reacting in anger and anxiety to each and every trigger that we get. And what's going on is that our unconscious mind chose this response from a resource it found that had similarities to the traumatic event that we went through. We need to now go back into that closet and dig out better options to deal with it. And really, since I don't know what's in the back of your closet, you are the one who has to go look for a better outfit to suit this situation. And it's there. You know, I told you before, that walk-in closet that represents our subconscious mind, that's 90% of our mind. So it's a huge closet. There's bound to be a better fit in there. You've been hoarding feelings and memories in there for as long as you're alive, after all. And that's where classical hypnotherapy may miss the point. With classical hypnotherapy, often pre-written scripts are read out by therapists while they relax you, and they tell you what to go looking for in that closet. And with advanced conversational hypnotherapy, what I do is I guide you into the closet, into that huge closet full of resources, full of different choices, away from, in this example, the anger and the anxiety. And it's then up to you to find an outfit from a memory and a feeling in the past that you had that will be a better suit for the situation that you're in, and that will give you back choice. Instead of becoming angry, you can now react in a different, better way for the situation. That's basically what I do. I can imagine that that's a big, long story, and you may have questions, so please reach out. I'd be more than happy to answer them. Thanks for listening. Take care.